And Dr. Simpkins, let me get your reaction to these new protocols released by the CDC. Are they enough, you think?
I think that they are, Jose. I think what happens was the original World Health Organization guidelines, we found out were not sufficient because there was skin exposed on the neck and on the chin. So now these new guidelines are much tighter, and the suits are designed for Ebola-type viruses that are spread through body fluids.
It just seems like it took forever for them to realize that maybe you shouldn't be exposing any part of your skin when you're dealing with something like this. It took a while, didn't it?
I think it seems like a while to the American public, and I think when you're dealing with a potentially fatal virus, people tend to panic. But in truth, Jose, this is the first time we've been dealing with this, and we're learning from our mistakes very quickly. Both the CDC and NIH are acting on this. A matter of fact, this morning in New York City, there's a huge conference of the Hospital Association at the Javits Center here, learning how to put on the garb, how to take off the garb, the buddy system. All 5,000 acute care hospitals throughout the country have issued guidelines. I actually think we're getting up to speed quite quickly on such a new disease for us here on the American side.
Yeah, and as you said, there is a lot of concern out there about Ebola, even though there's been so few cases in the United States. Check out these new polls. 45% say they're worried they or someone in their family will get Ebola. 45%. 63% say they're worried the U.S. will see a large number of Ebola cases within the next 12 months. And perhaps proving that point, a teacher in Maine has been put on 21 days paid leave just because she attended a teachers' conference in Dallas. How do we deal with people overreacting to this, doctor?
Well, this is our job as medical professionals to reassure the American public that there is literally one person on American soil who had contracted the disease. These two nurses that got it through him. It has been self-contained since that time. We have not seen a new case. A matter of fact, most of the people have come off quarantine. The rest of the people, hopefully in the next 10 days, will come off of quarantine. And we, as responsible medical professionals, need to remind the American public there is no need to panic. We need to worry more about things such as influenza virus and getting our flu shots than we really have to worry about Ebola. Our government is right on top of this now. Our medical professionals are right on top of this now. And we really need to pour our resources, time, effort, and money into the epicenter in Africa and stop the origin of this virus.
Yeah, and but I have a 10-year-old and a 7-year-old daughter, and indeed, in their classroom, the kids are saying, "Do you hear about this Ebola thing?" It just seems like maybe they should be worried about a cold or the flu or lice. I mean, those are issues that are really relevant to kids in every school, and yet they're talking about Ebola.
Because it's frightening. I mean, I can't minimize it. For myself, my own family, my patients, my friends, it's very frightening. We all recall when something new comes onto the world of medicine. We had it with HIV. We had it with SARS. We had it with avian flu. We all tend to panic about the unknown, but it is our job to reassure both children, parents, families, friends that there is really no need to panic, that you can safely travel to Dallas, that you could safely even go to Texas Presbyterian Hospital. So I really want people to be reassured that they need to wash their hands, and they need to worry about things such as enterovirus and influenza more so than they do about Ebola.
Wash your hands is the best lesson we can get out of this. Nancy Simpkins and Sarah Della, thank you so much for being with me this morning.
Thanks, Jose.